You can drink all the green tea and take all the supplements in the world, but if you're sitting 10, 12, 14 hours a day, your prostate is drowning from the inside. Look around right now. Where are you? Probably sitting. And while you're sitting there, gravity is doing something terrible to you. Your entire body weight is crushing down on your pelvic floor like a hydraulic press, and that pressure isn't just uncomfortable, it's starving your prostate of oxygen. I'm Dr. Natalia de la Cruz, and I need to show you why this matters right now. When you sit for hours, blood pools in your pelvis. It gets stuck, and when blood doesn't move, it becomes toxic. Think of it like standing water versus a flowing river. The river stays clean, oxygenated, alive. The pond? It stagnates. Algae grows, things die. Your prostate, when you're sedentary, becomes that pond. And here's what nobody tells you. That stagnant blood isn't just sitting there harmlessly. It's carrying hormones, specifically DHT, the hormone that makes your prostate grow. When blood flow stops, DHT doesn't leave. It accumulates. Day after day, week after week, feeding the enlargement you're trying so hard to stop. But there's something worse happening that you can't feel yet. Oxygen. Your cells need it to survive, to function, to heal. When you sit all day, oxygen delivery to your prostate drops by nearly 40%. Without oxygen, cells become inflamed. They scar, they harden. And that hardening is what makes urination difficult, painful, incomplete. You're not just dealing with size, you're dealing with tissue that's slowly turning rigid because it's suffocating. This is happening right now as you're watching this if you've been sitting for the last hour. Now, I know what you're thinking. Doctor, I'm over 60. I'm not going to start running marathons or lifting weights. And you don't have to. What I'm going to show you today requires no gym, no equipment you don't already have, and you can do it in your pajamas without leaving your bedroom. In fact, some of my patients do these movements right in bed before they even get up in the morning. But before we get to the movements, you need to understand the medical logic behind why this works. Because if you don't understand it, you won't do it consistently. And consistency is everything. Your pelvic region, where your bladder, prostate, and rectum live, is a high-traffic area for blood. Gravity pulls blood down easily, but getting it back up to your heart, that's hard work. Your veins have to fight gravity every single second. Add hours of sitting, and you create what we call chronic pelvic congestion. This congestion has 3 catastrophic effects. First, hormonal waste doesn't flush out. DHT and other inflammatory compounds just sit there, stimulating growth day and night. Second, cells suffocate from lack of oxygen, creating scar tissue that stiffens everything. This is called fibrosis, and it's what makes your prostate feel hard and makes urination feel like squeezing through a narrow pipe. Third, the muscles of your pelvic floor become simultaneously weak and rigid. They can't hold urine properly, and they can't relax enough to let it out. You get both incontinence and retention. It's a nightmare, and most men don't realize these 3 things are all connected to the same root cause. The exercises I'm about to teach you have one singular purpose: turn the stagnant pond into a flowing river. We're going to use gravity in reverse. Pump fresh oxygenated blood directly into your prostate and deliver all those nutrients you've been eating, zinc, magnesium, lycopene, straight to the tissue that needs it most. It's like opening the floodgates of a dam. But here's something critical you need to know first, because if you get this wrong, you could actually make things worse. You've probably heard about Kegel exercises. The internet is full of people saying, squeeze, squeeze, squeeze for a better prostate. Stop. If you have an inflamed, painful prostate, or if you struggle to start urinating, traditional Kegels, where you clench like you're stopping urine midstream, can make things worse. Why? Because your pelvic floor is likely already too tight. It's locked up from chronic tension and pain. When you've been dealing with prostate issues for months or years, those muscles develop protective tension. They're trying to guard the area. Squeezing a muscle that's already clenched creates more pain, more obstruction, more inflammation. It's like trying to close a fist that's already closed. What most men with prostate enlargement need isn't strength. It's release, flexibility, deep relaxation. That's what we call reverse Kegels or pelvic floor expansion. The 3 exercises I've selected today aren't about building muscle. They're about creating space, stretching the tissues around your prostate so it stops being strangled by tension. Find a comfortable spot. It can be a yoga mat on the floor, or if your mobility is limited, your own bed, as long as the mattress isn't too soft. You need some firmness to get the benefit. Lie on your back, and let's begin. The first movement is called the drainage bridge, and this exercise is critical because it uses gravity in your favor to empty pelvic congestion. When you elevate your pelvis above your heart level, you reverse blood flow. All that old, stagnant, oxygen-deprived blood that's been sitting in your prostate from sitting all day gets forced back toward your torso to be cleaned and refreshed. Your heart and lungs do the work of filtering it. It's like flipping over an hourglass and watching everything flow the opposite direction. Here's how you do it. Lie flat on your back. Bend your knees and plant your feet firmly on the mattress, hip-width apart. Your arms rest by your sides, palms down. Take a deep breath in through your nose, filling your belly, not your chest. Now, as you exhale slowly through your mouth, press your heels into the bed and gently lift your hips toward the ceiling. You don't need to go high. We're not doing Olympic gymnastics here. You only need to lift until your thighs and torso form a straight diagonal line. Some men can only lift a few inches at first, and that's perfectly fine. Hold that position. Count to 5 in your head. 1, 2, 3, 4, 5. While you're up there, don't clench your glutes hard. Keep them active, but your pelvic floor, the area between your testicles and anus, stay relaxed. This is the key. You want your glutes working to hold you up, but your pelvic floor soft and open. Feel the blood draining downward toward your chest. Some men actually feel a slight tingling sensation in their pelvis when they do this correctly. That's circulation returning. Now lower your back slowly, vertebra by vertebra, until you touch the mattress. Don't just drop. Control the descent. Repeat this 10 times. Slow. No rush. With each lift, imagine you're releasing pressure from your bladder, like opening a release valve. This exercise is pure gold right before bed because it relaxes the area and reduces the urge to wake up during the first phase of sleep. Many of my patients tell me this single exercise cut their nighttime bathroom trips in half within 2 weeks. But we're not done yet because now we need to create space. Most men have extremely tight inner thigh muscles, the adductors. These muscles run from your pelvis down the inside of your legs. When these muscles are tense and shortened from sitting, they pull on the pelvis and compress it like a vice. That external pressure crushes your prostate from the sides. We're going to open that vice with what I call the butterfly release, and this is where many men feel immediate relief. Stay lying on your back. Bring the soles of your feet together, one against the other, so your knees naturally fall apart. Now let your knees drop gently to the sides, one to the right, one to the left, like opening a book. Here's the expert trick, and this is important. If you have limited flexibility, which is very common in men, especially men who've spent years sitting at desks or driving, you'll feel a painful pull in your groin. We don't want pain. If it hurts, your body tenses up and the whole thing becomes useless. Your nervous system fights back against pain, and you lose all the benefits. Solution? Place a pillow or cushion under each knee. This way your legs rest on the cushions and you can relax completely without tension. Your knees should feel supported, like they're floating. Now, place your hands on your lower abdomen just above your pubic bone. Close your eyes, breathe deeply, and direct the air toward your hands. Feel your lower belly inflate and your hips open 1 millimeter more with each exhale. This isn't a repetition exercise, it's a duration exercise. Stay in this position for 1 to 2 minutes. Just breathe and let gravity do the work. You're not forcing anything, you're allowing. It's incredibly soothing and effective for chronic pelvic pain. Some men fall asleep in this position because it's so relaxing. And here's where most people miss something crucial. Your prostate isn't just affected from below. The front matters too. Many prostate and bladder problems worsen because we have a very tense lower abdomen or visceral fat pushing downward, creating constant pressure on the bladder and prostate. We need to stretch that abdominal wall to take weight off the bladder. We'll do what's called the gentle cobra or sphinx in yoga, and this movement is incredibly powerful for releasing deep tension. This stretches the psoas muscle and lower abdominals. The psoas is a deep muscle that runs from your lower spine through your pelvis to your thigh. When shortened from sitting for hours, it literally strangles the nerves going to your prostate. These nerves control sensation, function, and blood flow. Stretching the psoas releases those nerves and restores proper signaling. Carefully flip over and lie face down. Extend your legs back. Place your elbows under your shoulders and rest your forearms on the mattress, palms touching the bed. Gently press your forearms into the bed and lift your chest and head, looking forward. Important, don't lift your belly button. Your navel should stay glued to the mattress. You should feel a pleasant stretch, not painful, from your pubic bone to your sternum. Imagine you're lengthening your abdomen, creating space between your ribs and your pelvis. Breathe deeply into your belly. With your stomach against the mattress, you'll feel an internal massage on your organs every time you inhale. That internal massage stimulates prostatic circulation and also helps with constipation, which many men with prostate issues struggle with. Hold this position for 30 seconds. Lower to rest and repeat 3 times. If you feel any pinching in your lower back or kidneys, spread your legs wider or don't lift your chest as high. The important thing is stretching the front, not compressing the back. Now, before we finish, I want to give you a bonus, a secret that pelvic floor physical therapists often use that you can do alone. It's called perineal release, and this technique can be life-changing for men who struggle to start urinating. The perineum is that area of skin and muscle right between your testicles and anus. Right there, a few centimeters deeper, lives your prostate. Often that area is hard as a rock from tension, chronic inflammation, and years of protective guarding. That hardness is actually muscle knots, what we call trigger points. How do you massage it? Sit in a comfortable chair or on the edge of the bed. You can use a tennis ball if you're brave, or simply a small towel rolled up into a firm cylinder. Place the ball or towel right in the center of your perineum and sit on it carefully. Let your weight drop gently. It might be a bit uncomfortable at first. You might feel a deep ache. That's normal. Breathe through it. Make small circles with your hips over the ball or towel for 1 minute. Move slowly. You're not trying to hurt yourself. You're trying to release tension. This acts as a direct massage to the trigger points, muscle knots surrounding the prostate. It's amazing how this simple 1-minute gesture can facilitate the start of urination if you usually have difficulty starting the stream. Some men describe it as feeling like a blockage suddenly opens. But here's what I need you to understand about timing, because this is where most people fail without realizing it. When you do these exercises matters as much as doing them. Each time of day has a distinct medical benefit, and if you do them at the wrong time, you won't get the full effect. Option A is the morning routine to de-rust. When you wake up, your body has been immobile for 7 or 8 hours. Your prostate is asleep and congested. Blood has pooled overnight. The goal is to activate blood flow to start the day with energy and better function. Do the gentle cobra and the butterfly. These 2 movements stretch morning stiffness and will help you urinate better on that first bathroom visit, which is sometimes difficult. Many men notice the stream is weak or hesitant in the morning. These exercises fix that. Option B is the night routine for nocturia, and this is the most important one. If your problem is waking up 5 times a night, this is your obligation. The goal is to drain accumulated fluid from your legs and pelvis toward your kidneys before you sleep, so you can urinate it all out before turning off the light. Do the drainage bridge 30 minutes before bed. Here's the secret. By lifting your pelvis, you help fluid from your legs drain back up. During the day, especially if you sit a lot, fluid accumulates in your lower extremities. It's called edema. When you lie down, that fluid redistributes and your kidneys start processing it. That's why you wake up needing to urinate. But if you do the bridge first, you process that fluid before you sleep. When you finish the exercise, go to the bathroom and try to urinate. You'll see more comes out than normal. That's liquid that won't wake you at 3 a.m. It's pure hydraulic strategy, and it works. But listen carefully because this is where most people fail. These in-bed exercises are wonderful, but they're worthless if you then sit on the couch watching television for 4 hours straight without moving. I want to propose a deal. It's called the 30-to-1 rule. For every 30 minutes you spend sitting, watching TV, reading the paper, or at the computer, you have a medical obligation to stand up for 1 minute. You don't need to do squats. Just stand. Walk to the kitchen for water. Go to the window, stretch your arms, move. Why is this vital? Because after 30 minutes of sitting, circulation in your pelvis drops by 40%. The blood literally slows down. When you stand, you reset the timer. You reopen the blood faucet. If you follow this rule, your prostate will be receiving oxygen all day, not just when you do the exercises. It's the cheapest, most powerful habit change that exists. Set a timer on your phone if you need to. Get up, move, reset. Now, I know you have questions because every patient asks me the same things. Let me answer the 3 I hear most often. First, doctor, I have lower back pain, sciatica. Can I do this? If you have acute back pain, be careful with the bridge. Don't lift your hips high. Lift just enough to get your bottom off the bed, maybe 2 or 3 inches. That's enough to get the drainage effect. And in the cobra, don't straighten your arms all the way. Stay supported on your elbows. Listen to your body. Pain is a red light. If it hurts, stop. Modify. These exercises should feel good, not painful. Second, can I do this if I have a urinary catheter? If you have a permanent catheter, do not do these exercises without consulting your urologist. Pelvic movement could pull the tube and cause injury or bleeding. In that case, limit yourself to gentle walking and upper body stretches. Don't risk it. Third, how long before I notice improvement? This isn't a sprint, it's a marathon. Your body didn't get here overnight, and it won't heal overnight. If you do these exercises daily, usually within 2 to 3 weeks, you'll notice 2 things. First, it's easier to start your urine stream. The hesitation decreases. Second, the feeling of heaviness in your lower abdomen decreases. You'll feel lighter, more comfortable. Be patient. Give your body time to respond. We've come a long way. We've learned that sedentary lifestyle is the silent killer of the prostate, and that conscious movement is its medicine. Don't let laziness win this battle. I know it's comfortable to stay still, but the price you pay is your freedom and your sleep. Every night you wake up exhausted. Every day you feel that heaviness. That ends when you move. Tonight's challenge is very simple. Tonight, before you turn off your bedside light, don't fall asleep immediately. Spend just 5 minutes doing the bridge and the butterfly. Do it today. Do it tomorrow. Do it every single night. Your body is a perfect repair machine. It just needs you to take the brakes off. Unlock your pelvis and reclaim your life. Comment below where you're watching from because I see people from all over the world dealing with exactly this, and I read every single comment. If this kind of content helps you, if someone explained something clearly that you've been confused about for years, subscribe to this channel because here we talk about what almost nobody explains with clarity. And in the next video, we'll talk about something many of you have asked me privately: the truths and lies about sexual activity and the prostate. Does it help or hurt? You won't want to miss it. Move and heal.